students, we will actually be starting off with the College Motto Award. I'll read out a little introduction about the College Motto Award so you know the background, and then we'll go on to the actual presentation of the award. The College Motto Award was instituted by the batch of 1949 to recognize and acclaim extramural alumni who, in their life and work, have demonstrated the pursuit of CMC values as formulated in the motto of the college, with emphasis on service at some personal cost. While this may often be in rural, remote, or impoverished communities, or in the field of public health, any unpopular and underserved area of human need may be considered. The choice should be based on the closest available approximation of being steadfast, selfless, and significant. Candidates working outside the country could be considered only in case of exceptional merit as outlined above. So that's the background of the College Motto Award. This year, it has always been traditional that a member of the batch of 1949 or a close family member actually presents this award. So for the presentation of this award, we are honored to have Mrs. Sushma Nagpal. She is the daughter of Dr. Mary Das Gupta, who was from the batch of 1949. Like I mentioned, it has been customary that the award be presented by a member of the batch of 1949 or a close family member. So when Dr. Pizak contacted us saying that Mrs. Sushma is available during this reunion, we were overjoyed to have you here, ma'am. Mrs. Sushma Nagpal has fond memories of accompanying her mother to the alumni reunions. Dr. Das Gupta was actively involved in the initiation and maintenance of the award, and has also contributed generously to this reward on several occasions. And the fact that we're able to present this as both a certificate, a citation, and a cash award is due to people like her who have kept this award going. So what we will have now is I will invite Dr. Leena. She will read out the citation and the person who is winning it. And after that, we'll have Mrs. Sushma coming on stage with Dr. Alfred Daniel, our president, to offer the award.
Good evening, dear friends. I'm happy to read the citation of Dr. Susan Sunalini. Susan Sunalini Bijiga, tall, soft-spoken girl, ever willing to listen and help, hails from a small town called Hanamkonda in Warangal district. Even as a teenager, she committed her life to become a missionary, being inspired by the life of Dr. Ida Scudder. In September of 1993, her prayers were answered as she got MBBS admission in CMC, and her motto was reinforced during the freshers' orientation session when she heard, "You are not here by accident. Each of you are here, chosen specially for a purpose." She was active in social services and held responsibilities in the Evangelical Union during her stay on campus. Her room was always open for sharing and praying. Following her service obligation in CSI Karimnagar Diocese, she came back to work in medical ICU for a short period, but had to discontinue due to her mother's terminal illness. Her mom's sudden demise was a huge blow to Susan, as it was her mother who was Susan's pillar of support and strength. Despite opposition from her family, Susan went ahead to do her post-graduation in pathology from Osmania Medical College, Hyderabad. Through all the good and bad times, Susan did not forget her calling to serve the Lord. This was further strengthened when she married her husband, Mr. Reglan Remo Paul, in 2005, who is a social worker with a missionary society called Reaching Hand Society, based in Malkangiri, Odisha. Susan joined Remo in Malkangiri in 2008 after the birth of their oldest son, Adarsh, to lead a life fulfilling her calling. Since then, there has been no turning back. It's now been a decade and a half of serving the poorest and the marginalized. Malkangiri, a Naxal-infested region amidst mountain ranges, is one of the most backward districts in India. It's about 250 kilometers away from Bhadrachalam, where the nearest regular rail and road transport services are available. It has a population of about 6.5 lakhs, mainly constituted by indigenous tribes and Bangladeshi immigrants. Malkangiri, being endemic to malaria and tuberculosis, is also burdened with sickle cell anemia. The fear of contracting malaria, Naxal activity, and inaccessibility prevent NGOs and government organizations from venturing into this region. Hence, villagers preferred witchcraft over allopathic medicine. Susan took on the mantle of continuing to serve the people of Malkangiri from her mother-in-law, Dr. Iris Paul, who founded the Reaching Hand Society. The vision of the organization is empowering families, transforming communities, and their mission is to reach the unreached in a holistic way with the love of Jesus Christ. They also have a small hospital, St. Luke Temple Hospital. When Susan started her work, she was the only qualified private medical practitioner in that region. As not all villagers can reach St. Luke Hospital, village medical camps are the mainstay of delivering primary health care to people in this remote area. Susan works in the clinic till noon and then goes to villages to attend the medical camps. Some days she has to spend a whole day in medical camps to meet the needs of the villagers. Over the years, a team of social workers have joined work with Susan. She has trained many grassroots workers at different levels about immunization, health and hygiene, treatment for malaria, identifying common diseases prevalent in that region like sickle cell anemia, giving first aid for wounds and animal bites, counseling patients about anti-snake venom treatment following snake bite, even before they can come to the RHS clinic. The team is not only involved in delivering primary health care, but also in the socio-economic, psychological, and spiritual development of these marginalized tribal communities. Many times she has opened her rented house to accommodate the sick and destitute. Susan and her team provide the primary health care, but any complicated illness, they would have to transfer to the Naurangpur Christian Hospital or to Asha Kiran Hospital, Lamtaput, which is at least 4-hour drive on narrow roads. Today, the society consists of 21 staff, which includes Susan and her husband, a lab technician, a pharmacist, a nurse, and a team of dedicated field workers. The society presently works actively in 74 villages. Susan and her team are involved in imparting education to the prison inmates of Malkangiri district, counseling and training them in various vocations like tailoring, craft using woolen threads, rice jute bags. They counsel the prisoners to get back their self-respect and counsel the prisoners' families to accept them. They also help rehabilitate them once they are out of prison through small business ventures. Susan is highly regarded by the prison officials, hence often invited to many of their official meetings, as they have seen the transformation in prison inmates through her and the team's counseling. Imparting health education in village schools is another front where Susan is actively involved. She visits local schools routinely and imparts health education to children about personal hygiene, community hygiene, first aid, and infectious diseases. She coordinates drawing and essay writing competitions where the tribal children and others in the Malkangiri district are encouraged to express their views and ideas. Burdened about the children of villagers who are not able to go to school, the RHS team delivers primary education to the children by teaching them in the community center, which is often under the shade of a tree or any house veranda. She also started vacation Bible value-based programs in many villages during summer vacation. The love of Christ is imparted through their action and in word. Women empowerment is another major task that was undertaken to face the challenges of tribals. Through her talks and counseling, she has brought in a tremendous change in their mindset. Now the villagers accept to send their girl children to school instead of keeping them at home. Giving children for marriage at 14 to 15 years of age is common among tribals. Due to regular awareness program, girl children now wish to marry only at the marriageable age after having completed their schooling. Empowering families with good values and initiating discussion based on the incidents around them have encouraged the villagers to take wise decisions regarding children, education, marriage, and contraception. Reaching Hand Society also supports the self-help women groups to learn vocational skills, thereby contributing a considerable income to their families. During the COVID pandemic, Susan efficiently prepared her staff and village-level workers by teaching about COVID, providing COVID kits and other essentials to all village-level workers with the generosity of well-wishers and other like-minded organizations. Village youngsters joined hands with the team to set up basic medicines in certain houses in each village to meet the immediate need of the villagers. Most of the villagers under their work survived both the waves of COVID without much mortality rate. Apart from that, Reaching Hand Society could provide face shield to the district healthcare department and police department, dry food to 24,194 returning migrants during both COVID waves, and dry rations to 2 phases covering almost 400 villages, serving more than 11,000 families. The team also provided needed essentials for all the prisoners as their relatives couldn't visit during the COVID season. Susan's husband, Remo Paul, is her constant support, encouragement, and companion in all her efforts. He is a regular motivational speaker at many conferences. They are blessed with 4 sons, Arthur Stephen, 14 years, Jay Daniel, 12 years, Nirbhay Joshua, 10, and Adil Joseph, 8 years. The education of the children was a concern in such a remote location. The mission school by IMST was their only choice after prayer. The children are still studying in this school in Malkankari, which is now a recognized CBSE school and well sought after. During these past 15 years of being in Malkankari, according to Susan's own words, every healing they witnessed, every blessing they received is an answer to prayer. Health-related problems did affect her as well as her family, including an episode of viral encephalitis in Susan's life in 2017, but they have witnessed the healing touch of God time and again, which has supported them and carried them every time they were tired and tripped. Over the past 15 years, Susan has seen major changes in the development of Malkankari district. Incidents of malaria drastically reduced. The official report quotes a significant drop in annual parasite incidents to 11% in 2020 from 44.76% in 2015. January 2022 has seen a drop of more than 80% in caseload compared to January 2020. There is also a reduction in the infant mortality rate and maternal mortality rate. Roads are widened, shops with basic and necessary facilities have opened up, thus bringing development to the district as a whole. Indeed, Susan, being true to her calling, has taken on herself the huge challenge of taking healthcare to this backward district in Odisha, as well as in the promotion of socio-economic status of the poor, the marginalized, and the destitute, and ever willing to serve them through the love of Christ. The CMC Alumni Association is proud to present the College Motto Award for the year 2020 to Dr. Susan Sunalini.
Dear friends and family, I'm honored to receive the College Motto Award. I thank the batch of 1949 who instituted this award and the CMC Alumni Association of the college for considering me worthy to receive this award. I want to tell you a story. 6 years ago in a village on the hills, we were there for a medical camp. After seeing a patients in a village, we needed to walk to the other village to the fields and springs of water carrying our medicines and equipment. I watched a boy who ran excitedly before us, wanting to show the way. There was something wrong with his hand, the way he held. He was a Kondo child and I didn't know a word in Kuvi language. After we reached the place, I examined the child and knew he had a fracture. On asking him if he had a fall, he said he fell from a tree and didn't tell his parents. On asking him, his father was a drunkard, a migrant laborer, and mother was working very hard. As soon as we came back, I reached out to our staff to explain the need to fix his bone. His uncle was very receptive, and the next day the boy's hand was plastered. Day by day, there has been a complete transformation in this beautiful family of 4. The key was to be present. My dear friends, there is immense need for good, committed professionals to work in needy areas. I'm thankful for friends and teachers who were mindful of me and were available for advice and help. I had to deal with many infectious diseases, especially malaria, sickle cell disease, SLE, burns, attacked by bears, anaphylaxis due to bee bites, fractures, seizure disorders, rheumatoid arthritis, affecting young girls, most of them discovered after they developed deformities. There were many with injuries to the eye, cataracts, deafness, waiting to be treated. Like any other rural areas, vitamin deficiencies, anemias, worm infestations, various dermatology disorders have been successfully treated. Once diagnosed, helping them to get into vertical programs of TB and leprosy have helped them to complete their treatments. Investigations, however, was a major challenge. Standing for ethical practice such as rational use of antibiotics with minimal investigations was difficult but not impossible. I did lose patients for not being able to convince them enough to come to the hospital for investigations and treatment, as they had their witch doctors. However, an elderly man with pain in the foot, a lady who lost 7 infants, yet refusing to visit the hospital for her 8th pregnancy, a child with febrile seizures left to die, a young mother who lost 3 infants, 2 with sepsis and the 3rd with a congenital heart disease, if were not intervened persistently and forcefully, wouldn't have been able to see today. We plan, but it is God who makes it happen. Small things become big hurdles, yet the key is not to lose heart. During this period of waiting, it has helped me to continue to do what was before me. I did learn a few lessons which I want to share with you. Invest time in people around you, children, youth, adults and elderly. Help them to grow with good understanding and wisdom. Encourage them to take wise decisions. Give time for reflection and change. The Bible says, all things work together for good for those who love God, who are called according to His purpose. In my life, I've seen that sicknesses, encounter with wild animals, fractures, head injuries, deaths, accidents, everything was good. If things are being delayed, when our wishes and prayers are not answered, hold on. God is at work. Secondly, be receptive to your life's calling. Believe the one who has kept you where you are, even if you are invisible. Take every opportunity to do good. Go the extra mile. He will use you for His glory to accomplish the purposes He has for you. The Bible truly says the harvest is plentiful, but the workers are few. It also says, lift up your eyes and look on the fields, for they are white and ready for harvest. The opportunities to serve are right before your eyes. There are many peripheral hospitals with minimal resources doing an excellent job of healing with compassion. I understand that the remuneration at these rural-based hospitals is low, but that will not be your only source of income. God's resources are unlimited, and I have seen His providence in many unexpected ways. He is mindful of us. The most important advice is to spend time in reading God's Word, the Bible, meditating on it day and night, which will strengthen, encourage, and put light in your way. Be in fellowship with people who fear God. Their love, support, constant prayers, and words of wisdom will help us tide through difficult times. My mother-in-law was a one-woman army and achieved much. I am a team person. Though alone at the beginning, I was joined by a nurse who stayed with me for more than 10 years. A lab technician soon joined us. She was trained in Hyderabad for cytology and histopathology for 3 months. He stayed for a year and left due to family problems. The time in between was hard and depressing. The nurse also left a year back due to health reasons. But within this year, the Lord has blessed us with a team of 4 in the clinic, and 21 of us in Reaching Hand Society, committed and working together. The scariest moment of my life was during the Kannamal riots when the persecution was at its peak. Standing with Remo, who was always there for the people in Malkangiri, challenged me to stand firm in the faith I believe in and silently support in the way I can. I am eternally grateful for the loving supporting family, especially Remo Paul, my husband, and our 4 sons, Adarsh, Jay, Nirbhay, and Adil, who have been extremely sacrificial and understanding throughout this journey. I'm thankful for the love which held us thus far and continues to be our strength and guide. Every day is a new day with its challenges and blessings. Through the overwhelming situations, anxious moments, doubtful times, resting in God's refuge has brought us thus far. I extend my invitation to take time to visit us at Malkangiri and be part of the work we are doing in this beautiful district. There is still much more left to do. We look forward to having you with us. I once again thank the College Alumni Committee for this opportunity. Thank you.